Okay, hi. So I have just knocked. I have washed my hands. I have introduced myself. I will be doing the assessment on myself as my partner, my boyfriend, had to go out of town unexpectedly at 5 o'clock in the morning. So I have identified myself with two identifiers, which were my name, first name and last name, and my date of birth. I have provided privacy. We are in a private room. The door is shut. I have explained the procedure that I will be completing a head, ears, eyes, nose, and throat assessment. And if at any time throughout the procedure, if I feel uncomfortable, I can ask to stop. I have ensured safety and comfort. So I will get started on my assessment. Okay, so I am going to set this up here. So I'm going to start with my head. I've noted the shape and size. The head is nice and round, shape proportionate to the body and size. I will feel around on the scalp. There are no masses. I would check through all the hair all over the head, make sure there's no lesions, no parasites. I'm also at the same time checking hair distribution. Hair is equally distributed throughout the hair. It's kind of thin, but it's still equal. And there are no parasites. That would also be checked all over the head. Okay, no discomfort there. I will then move on to eyes. I have checked the eyebrow symmetry. Can move up and down. Also smile. Do that all at the same time. The eyebrow hair distribution is even. It is thinning a little bit here on the outsides, which is typical finding with age. Eyelashes are also thinner, but they are intact. There is no discomfort. There's no signs of infection along the eyelash lines. I am checking the lacrimal nodes or lacrimal glands. There's no swelling, no discomfort. The sclera is nice and white. I do see some veins in the eyes. That is small capillaries. That is a typical finding on the sclera. There's no foreign bodies. There's no itchingness. There's no tenderness, no drainage. The eyes look good. Okay. I am going to now check for pupil reaction. Okay. So what I will do is start from the outside of the eye and check how the pupil reacts to the light. Okay. To the other side. Very good. I'm also noting consensual adjustment over there when the light shines a little bit. Okay, I'm going to, the eyes are equal and reactive and round. The eyes are, the pupils are equal, round, reactive, and to light and accommodation. I could not get that out. I'm going to check for accommodation by having myself look at a object up close and then further away. Up close, the pupils should constrict, and further away, they should dilate. Okay, so the accommodation is intact. Okay. Okay, let's see. I'm also going to check for my peripheral vision on both sides. So you would start just at the sides of the member and then have them tell you when they do see the object. Yes. 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 If you notice any discrepancies, you would check each side individually to get a better idea. And then also we are going to check the 6 cardinal directions of gaze. So you want to kind of do an H. So I will start in the right upper corner here and have my eyes follow it down. Bring it back up. It will go across, up to the left corner and down. And then we'll bring it back up and across and then up and down in the center. Also, when I was checking my pupils, I did not note any nystagmus or involuntary movements of the eyes. So the eyes are looking good. I will now do the Snellen chart, which you have the member stand 20 feet away. So I'll just pretend I'm standing 20 feet away. Let me set this down here. And then you have the patient read the line lowest on the chart that they can read without mistake. And you cover one eye and have them read the lowest line. So we will say D, J, O, C, L, M, N. Good. Okay, next eye. And it will be the same line. I don't remember the letters. D, J, O, C, L, M, N. Okay, so then you would look on the chart at which line that was. It will tell you the person's vision. It is 20/20, which means I can read from 20 feet what a regular person can read from 20 feet, which that's very good. Okay, and then we will move on to the ears. Okay, so I've already checked when I was just kind of checking the symmetry of the face. The ears are in the same placement. They have the same size. Let's see. There's same shape. I would lift the auricle up here and look down in the ear, the outside auricle, kind of for any drainage. Color's good. It's pink. It is blanchable. That's always good. And then there's no tenderness. And then I would push on the tragus. See if there was any discomfort there. I will then do the other ear, up, back for adults. Look on the outside. Again, the ear's pink, skin's intact. No lesions, no sores, no drainage. Push on the tragus here again. No discomfort. Okay, ears look good. They are intact. And let's see. Then I would assess hearing. So what I would do was stand behind the member or the patient, close up one ear, and then I would stand about 2 feet behind the member on the side of the ear I was checking, and I would whisper a word or a series of words and have them repeat it to me, and then do the other side. And the hearing test is good. Whisper test got 100%. Okay, so now I'm going to check the nose, which we will come into the bathroom here for that. Okay, nose symmetry is good. I would use an otoscope or some type of light to look up into the nares. The nares look good and pink, moist. There's no lesions, no tenderness. Nasal septum is in line. There's no deviation noted. Also, when I shine the light, I do not see any light shining into the opposite nostril. So that is good. That also shows that the septum is intact. Okay, no tenderness. I will now do a breathing test. I will hold on one side and breathe in and out of the one nostril. Okay. Okay, that test went well. Breathing is good. Okay, I did not note any swelling. Now I will palpate the frontal and maxillary sinuses for tenderness. Now, since I'm holding the camera with one hand, I will only do it with one hand. But typically you would do this bilaterally with both hands at the same time. So I will press in and up here on the eyebrow line here to assess for these sinuses with no tenderness. Then I will also palpate down here, no tenderness. I'll do it here just for this, no tenderness. No tenderness here. Okay, wonderful. So that completes the nose assessment. Now I will start on the mouth. So I will assess the lips. They are pinkish red in color. No dryness, no cracking. Everything is intact. I will then check the teeth. All teeth